discussing the first aid in pulmonary bleeding. My colleague will be discussing regarding the procedures, and I will do a brief introduction and summary. What is pulmonary hemorrhage? Pulmonary hemorrhage, or PHEM, is an acute catastrophic event characterized by the discharge of bloody fluid from the upper respiratory tract or the endotracheal tube. The onset of pulmonary hemorrhage or pulmonary bleeding is characterized by the oozing of bloody fluid from the nose and the mouth or endotracheal tube with associated rapid worsening of the respiratory status, cyanosis, and in severe cases, shock. Bleeding may be noted from other areas. Degrees of pulmonary bleeding is divided into 3 degrees. The first degree is hemorrhage less than 300 milliliters. Second degree is hemorrhage less than 700 milliliters, and third degree is hemorrhage exceeding 700 milliliters. The treatment are mainly to stop the cough, decrease the pulmonary blood pressure, and hemostatic therapy. Next, a little brief summary. A wide spectrum of severities in patients with pulmonary bleeding with a range of mild hemoptysis to severe bleeding with an acute risk of asphyxiation. For the management of acute pulmonary hemorrhage, it is essential to identify the underlying cause in order to initiate a target-oriented or causal therapy. The most common causes of localized pulmonary bleeding are lung cancer as well as infections, anticoagulant therapy, or bronchiectasis. Diffuse alveolar hemorrhage is mostly due to pulmonary vasculitis or connective tissue diseases, but may also occur in pulmonary metastasis, congestive heart failure, coagulation disorders, and from many other causes. In a case of severe pulmonary bleeding, it is essential to secure the airways and ensure sufficient ventilation, for example by intubation with a double lumen endotracheal tube, and by appropriate positioning of the patient. Stabilizing the hemodynamics is very crucial.